Back and hip pain can be debilitating and oftentimes lead to surgery if left untreated. Now, fortunately, back and hip pain are two of the most popular problems that I help people with. You see, you've got the brain and then you have the back and the hip. Now, the door between those two is that atlas vertebra, C1. Now, if this atlas vertebra misaligns, the spinal muscles that control the back and hip will instantly go into spasm, and it will usually be one-sided, either the right side or the left side. Now, the muscles at the top of your neck, called the suboccipital muscles, are the most sensitive muscles in your entire body. Now, what that means is that if they stretch and go into spasm, then your entire back will go into lockdown mode as a protective mechanism. Now, when this happens, this is what's going to cause the hips to tilt. And then if you neglect this misalignment for too long, this is when your back and hip will start developing arthritis and then bursitis. Again, as a protective mechanism to strengthen this area. Now, if you still wait and do nothing about this pain and arthritis, typically a surgical consult is often recommended. So don't let it get that bad. The pain is a sign that something is wrong, so that way you'll do something about it. So make sure to listen to your pain. Unfortunately though, most doctors want to hit the snooze button and throw out your body's internal fire alarm by prescribing medication, which is never a long-term solution. You know why? Because you'll never fix a structural problem with a chemical solution. You need to get to the root of what's actually causing the problem, and that's where I specialize, providing that structural solution. As a NUCCA upper cervical chiropractor, the first thing that I need to do is take specific x-rays of your atlas to see if it's misaligned. Now, I have advanced spinal software that allows me to measure your atlas down to 1/100th of a degree, which is critical when it comes to actually realigning it. Now, these x-rays are the most important thing that I can do for you as a NUCCA doctor. Now, after I measure the exact position of your atlas, then I'll be able to correct it. Now, the realignment is so gentle that anyone would feel comfortable with the amount of pressure that I use. Gentle, slow, sustained pressure for about 30 seconds right below the earlobe, and that's all that's needed. There is no twisting, popping, cracking of the neck. Then after that, we will definitely want to retrain your neck muscles for a few months, realigning you as needed to make sure that you stabilize to get those long-term results. But other than that, that's pretty much it. So if you're curious to see if your atlas is misaligned, make sure to schedule an appointment with a NUCCA doctor near you as soon as possible to see if you're the right fit for treatment. Have a great day.